Hey everyone, welcome back to another episode here on Doctors Go Live with your host. I'm Nina Sharil Khan, and today we are going to be talking about dental health in aging, what you need to know. Now, let us know if you're tuning in, where you're tuning in, and say hello to us because we would love to hear from you. And of course, what would you like to learn in today's episode of Dental Health in Aging, what you need to know? Now, if you share this video out as well, you get to take part in our Doctors Go Live quiz that's happening right at the end of the Q&A where you get to win. Today, it's some portable soup cups. I would love one, so make sure you pay attention. All right. Now, all this is happening right here in Doctors Go Live with me and our special guest for today. Now, what do we need to know about maintaining good dental health in our senior years? I thought that I was pretty much sorted, but apparently not. It's really important to maintain our dental health, but did you know that as we age, there are certain unique problems or dental issues that older individuals face? Fortunately, understanding what these challenges are and knowing how to address them, we can help preserve our teeth all and our health all the way into our golden years. And that's what we're going to find out and learn in today's episode of Doctors Go Live. We're going to be joined by our very own consultant, dental surgeon, Dr. Athinia Wong from Columbia Asia Hospital, Bintulu. So if you know someone where this information is going to be useful or it's such an important topic that you want to share it out, please do share it out on your social media. Please tag your friends and invite them because it's definitely going to make a difference to somebody out there. Now, let's take a look at this video.
As we age, our dental health often face unique challenges that can significantly impact our overall well-being. Thankfully, with proper care and knowledge, we can effectively address these issues and maintain healthy teeth and gums throughout our senior years. Hi, I'm Dr. Athinia Wong, consultant dental surgeon from Columbia Asia Hospital, Bintulu. Join me in the next episode of Doctors Go Live, where we will discuss common dental health issues in aging individuals and share how you can keep your teeth and gums healthy. Happening on Wednesday, 26th of June at 3 p.m. See you then.
Welcome back. You are watching Doctors Go Live with me, Nina Sharil Khan. And if you just joined us, today's topic is we're looking into dental health as we age, because apparently as we age, there are certain unique dental issues that older individuals face. Now, what are these challenges? That's what our guest today, Dr. Athinia Wong, consultant dental surgeon from Hospital Columbia Asia, Bintulu, is set to cover. So that even if we are 150 years old, we will still have awesome teeth. So please, ladies and gentlemen, please welcome Dr. Athinia.
Hi.
Hey, welcome. Thank you so much for joining us.
Thank you for having me.
Okay, just a reminder to our audience, right at the end of my interview with Doc, we're going to go into Q&A. So if you have any questions at any time, please type it out in the comments and we'll get to you at the end of the session. And also pay attention because Doc is going to share some useful information and info that we're going to be used to ask you during the quiz section where you get to win portable soup cups. All right, so let's go, Doc. Again, if you have any questions, let us know in the comments. All right, so before we begin on this topic, Dr. Athinia, could you share with us a little bit about yourself and what exactly you do as a dental surgeon and what sparked your interest in dentistry? And do you especially focus on dental health for aging individuals? How does it work? Do let us know.
All right, sure. So I'm a dental surgeon or dentist. So I graduated from Massa University in 2016, and then with a degree in DDS. And I commenced my service with the government in the mid of 2017. And then by 2020, I transitioned into private practice. I joined the STEAM in Columbia Asia's Hospital, Bintulu. So the thing is, why I'm interested in dentistry is that I feel like dentistry offers a unique blend of science and art, and I think that's very interesting. So it's very cool in the sense where you can be artistic in the work that you do, and at the same time, it's like very also it helps people with their health and with their livelihood. So I also feel like having the opportunity to bring out the confidence in someone's smile is very fulfilling.
Wow. Okay. So you mentioned art. What do you mean by art? I would never have thought as, a dental surgeon or a dentist being an artist. So what do you mean by that? If you could share quickly.
Like for example, when you do a filling, right? So it's not just you just make a hole and then you put it with the filling, right? You need to have the curvature, you need to preserve the dental anatomy in order to make sure that the person is able to chew properly, to use that tooth properly, and also at the same time you need to be able to make sure that that filling stays in place in the mouth. So that's why I feel like there's like a science behind it and also like an art. So it's like it goes hand in hand. So it's pretty cool.
All right. Awesome. Exciting. Now, why is it important that we talk about this topic today? Because when I first heard it, I was like, I think I got this sorted just because I wore braces when I was younger. So I assume that as I get older, I'm not going to face any problems if I continue the way I take care of my teeth. What do you hope that the audience will take away from this episode, or at least start telling their parents and their kids, you got to take care of your teeth. So why do you think it's important we discuss this topic today? And what do you hope the audience will take home after this episode?
Okay, so why I think this topic is quite important is because there's several reasons, right? So firstly, overall health. The mouth, our teeth, gums, it's all part of our body. So the thing is, it is very closely related to our health. So if there's a problem with our mouth, there's going to be a problem with our health in general. And then quality of life. So if we have good teeth, we have good quality of life. We can eat, we can speak properly, and all that. And then we can also socialize comfortably with people, right? We can smile nicely. And then other than that, I noticed that there's an increased risk of dental problems in seniors because of their medications, their overall health condition. So I think that's pretty important to bring an awareness to these issues in order to be able to know what to look out for. So the community will know to uh, what to do in the future if they have like whatever it is in their mouths, and then they can see a dentist. And
Okay.
yeah.
The last part that you shared, where we need to increase the awareness in terms of awareness on dental healthcare as for seniors, how many percent do you think we are at right now? Uh,
Sorry.
just how many percent? What is our awareness level right now on dental healthcare for seniors on a scale
Mm,
of 1 to 100?
1 to 100. I would say maybe like it really depends. Like
Mhm.
different areas would have a different level of awareness. Like for example, in cities, you'll have more awareness, whereas in rural areas there will be less. Like because a lot of the older people in rural areas, they feel like having teeth is a chore, so they just want to extract everything. So whereas in cities, they want to do root canals, they want to do crowns and bridges. They want to do dental treatments. So there's also that we need to consider. So I would say like maybe like 50-50, I would say. Yeah,
Okay, 50-50. But definitely we need to be aware that things change as we age and we need to be prepared so that we get best results, right?
that's correct.
Okay, awesome. So Doc, what happens to our teeth as we age actually? Because I really did not understand it. If you could share with us roughly.
um Sorry.
I think we can have the slides now, right?
Yeah.
Okay, here we go.
So we're starting on the first slide, right?
Yeah,
Okay.
yeah, this one.
Okay, so the thing is, aging brings several common dental problems due to changes in the mouth and the body overall. Okay, so as we age, our bodies undergo numerous transformations that can affect the oral health. And at the stage, dental health becomes increasingly important for overall well-being. So basically, as we age, there's like wear and tear in our mouths, in our teeth. So we just need to look out for those things, right? Uh,
Mm-hmm.
the next slide. Okay, so what is dental health? Dental health, it basically refers to the overall condition of our teeth, gums, and our mouth. Okay, it includes various aspects such as the oral hygiene, dietary habits, regular dental checkups, and also the prevention and treatment of oral diseases. All right, so
So that's
next.
what we're focusing on. So, what are some common dental problems or issues that affect older adults? Oh, I'm sorry.
Um,
Yeah.
there's quite a few actually. We can see on the next slide.
Okay.
Um,
But do you want to cover this first?
Okay, so importance of dental health. So we know, I think everybody knows, but if you don't, well, maintaining good dental health is crucial for our
Mm,
overall well-being. Okay, so we need our teeth because we need our teeth for chewing, articulation of speech. Basically, we need our teeth to speak clearly, right? And it contributes significantly to the structure and the appearance of the face. So if we don't have teeth later on, our face will look different. So poor oral health can lead to infections, pain, and even contribute to systemic diseases. And that's why regular dental checkups and proper oral hygiene are essential,
okay.
right?
Got it.
Okay, so the key components of oral health would be firstly, oral hygiene. So you need to brush your teeth twice a day, every day. Other than that, you should probably consider using dental floss. I know that a lot of people don't really practice flossing their teeth, but I think with flossing, it kind of, how do you say, it assists with your brushing. Okay, so because the thing is, when you brush your teeth, you can't really reach between the teeth, right? So that's why we need to floss. And then, other than that, a balanced diet is very important. Not too much sugar in our diet, because sugar is basically the main cause of cavities, which we will get to later. And then, thirdly, we have regular dental visits. So, why we need to visit the dentist regularly? I know that a lot of people, they go to the dentist only when there's pain, right? When there's like a swelling or anything. So that's like basically when things get worse. So we should go more often so we can catch these problems before it becomes before it becomes worse. All right, and then after that we have fluoride. Fluoride normally we will see in toothpaste, so that's why when we brush our teeth we need to use toothpaste. And also fluoride we can find in water, sometimes milk. Okay. Next, avoiding tobacco and limiting alcohol consumption. So I think this one is very, very common knowledge that we should avoid using tobacco and avoid using any alcohol drinks or beverages or whatever, because it can lead to diseases like cancer and so on. Okay, and then other than that, we need protection during sports. I know that with sports, sometimes if you're unlucky, maybe you get a ball in the face and then suddenly you lose a tooth. So that's why we need these things.
All right.
Yeah.
Got it. Okay. And I guess now we can look at common dental problems. I was a bit early.
Yeah. Okay. So the common dental problems, right? Okay. So did you know that actually 5 out of 10 Malaysians at the age of 75 and above have lost all their teeth? So that's quite sad, actually. So and then 8 out of 10 Malaysians experience dental problems. So one of you guys out there watching this right now could be having a dental issue right now that you don't know, that you might
That,
know, that you might not know. So yeah,
that's that the number is pretty staggering.
yeah.
Would you be sharing why this is so? Is it because we're not aware, or how? Or you
Uh,
maybe to that?
sorry.
Why is the number so high? What's the reason?
Like I said, for okay, for the 5 out of 10 of Malaysians, that one is because like older generation, they don't really care for their teeth, and then they don't they feel like having teeth is a hassle, especially in the, like I said, in the rural areas. So that's probably one of the contribution of this high number. And then also at the same time, the 8 out of 10 Malaysians. So there are several diseases that we have that might not show any symptoms, so that's why people just overlook whether or not they have these issues. So that's
Right.
why,
Okay. Right.
yeah.
Okay. Yeah. Okay, so we have, if you have questions, please let us know in the comment kind of thing. So let's look at these dental problems, I guess, in more details, right?
Yeah.
What are they?
So
Yeah.
all right, so these are all the dental problems. You have tooth decay or cavities, dental caries we call it. Okay, and then you have gum disease. There are several types of gum disease, and then halitosis, that is basically bad breath, and then tooth wear, sensitivity. That's when you feel pain when you eat ice cream. That shooting of lightning through your mouth when you eat ice cream, basically. And then you have receding gums, and then dark yellowing teeth. I think that's a very common one. Other than that is tooth loss, dental problems, and TMJ disorder, and finally oral cancer. So these are the few typical dental issues that are experienced by older adults.
Okay, awesome. And we're going to look into each one of them, starting with tooth decay. Could
Yes.
you share, shed some light on what exactly is tooth decay, what causes it, and who is mostly at risk?
Okay, so tooth decay or dental caries, it is known as a it is also known as cavities, and it is the breakdown of tooth structure due to acids produced by bacteria in the mouth. All right. So, next slide. So it can come as a shape of a cavity in the tooth, and also sometimes it's like a whitish spot. All right. So in this
Mhm.
next slide, you can see these are the factors of dental caries. All right. So with these four factors, cavity will form in your tooth. So you need, number one is your tooth. If you don't have a tooth, you won't get dental cavities, of course. So then the main factor is bacteria and sugar, right? And then after that, time. Okay, so go to the next slide. Uh, oh, actually, there's actually a slide, like a picture behind this picture.
Oh,
Uh,
okay.
yeah.
Um, is it this one? No.
No, no, no. Okay,
Okay.
never mind. It's okay.
Mm.
So the thing is, so you can see here, this is the cross section of our tooth. All right. So you can see how there's layers, different layers, and so how these cavities they're formed is that when you eat food, like for example, sugary food or any other types of food, it has hidden sugars, right? So this food, when it's stuck to your tooth, it interacts with the bacteria that is always in our mouth. They feed on the food that we eat, the food particles on the tooth, and then their byproduct is acid. So this acid then works on the enamel of your tooth, and it causes the enamel to erode, and slowly the cavity is formed. And then the longer this acid is on your tooth, the bigger, or yeah, the bigger basically the how the cavity is formed. So that's why for us in adults, right? You
Mhm.
can see how there's recession, gum recession, and all that. So
Yeah.
their roots show. So the thing
Mhm.
is, when our roots show, we don't have enamel on our root, right? The layers are the layers of enamel is only on the crown of the tooth. And so that's why it's easier for cavities to form on the root surface of the tooth because the protection is less. Like because the root surface is much softer compared to our enamel.
All
Right. So
right.
it's, yeah, the cavity formation is very fast basically and very easily formed.
When you say fast, how long we're looking at?
It really depends. It depends on how the person takes care of their teeth. Let's say if they never brush at all, like they don't brush, so cavity would maybe be formed within a month or so, maybe
That
faster.
is that is fast. I
Yeah.
think it's fast. Yeah. So basically, tooth decay is when you've got bacteria from the food. It creates acid, and that acid sort of huckies the protection, which is the animal, and your teeth get smaller, is it? And it shows the roots and stuff like that, and it gets exposed, right?
Yeah, basically tahakis, it means that your gums, it recedes, it becomes, your tooth becomes longer, so your roots become visible. So that's
Right.
how, yeah, it stuck. I mean, like the bacteria is definitely always in our mouths, and
Mm,
then the acid then gets onto the root because it's exposed, right? So that's
mm.
how it forms.
Okay, got it.
Yeah. Okay, so you can see here the stages of tooth decay. So it doesn't actually like form the decay immediately, right? So it will start first like in a white spot lesion, and then it goes deeper and deeper as time progress, right? Sometimes it may stop, but sometimes it may get worse. It really depends from person to person. So you can see here at the far side here, you have the healthy tooth, and you have the cavity, how it begins, right, and the enamel or the root surface, for example. And then after that, it gets deeper and deeper as time progress. The cavity breaks down into the dentin, and then finally into the pulp. And then when it gets to the pulp, that is when you start feeling pain. You get abscesses, you get pus coming out, you get a swollen gum, swollen cheek, and all that. So yeah,
Wow, and it's really towards the end, right? Yeah.
yeah,
And
that one
this
is
whole,
the end.
yeah, this whole process takes how long again, you said? Around
Uh, okay,
what?
so towards the end of this, maybe years.
Oh, okay.
But yeah, but the formation of the initial formation of the cavity, like a small white spot or a black spot, it can form, depends, like I said, maybe fastest I would say maybe 1 month or 2 months. Yeah.
Okay. And this is why
Yeah.
it's important to go for a regular checkup so that, we
Yeah.
can handle it earlier, kind of thing. All
Yeah.
right, let's take a look
Yeah.
at the next one. So the next one is gum disease, right? So what is gum disease? And are there any common early signs or symptoms to help prevent it?
Yeah, okay. So gum disease, right? So it's an infection of the gums and bones that support the teeth, okay? So it can lead to tooth loss at the end of the day, and it is more prevalent in older adults due to factors like plaque buildup, tobacco use, and certain illnesses like diabetes. So infections of the gum can progress and destroy bone structure, which supports the teeth, leading to loose teeth and may cause tooth loss, okay? So you can see here this is like the beginning stages, right? You can see here some plaque, or we call it calculus or karangigi. So these are like hard structures stuck to our teeth here near the gum area. Okay, so this one will later on cause some irritation, and then you will have gingivitis, for example. So you can see here actually this person have a little bit of gingivitis, some redness along the line of the gums here between the teeth and the gums. You can see just a little bit of redness. Okay, and next slide, you can see here two types of gum disease. You have
Mm-hmm.
the healthy gums, right? And then you have gingivitis. You can see how the outline of the gums, there's like redness, yeah, inflammation. And then, so with this, it can progress to periodontitis, which is the picture on the right. Uh, yeah, in the right here, you can
Mm-hmm.
see how you have some elongated tooth. You have this swelling in the gums, right? And then it's possible that also some of these teeth are mobile.
Wow.
Yeah.
Kind of. Okay. Got it.
Yeah. Next slide.
Oh,
Okay, so what is gingivitis, right? Gingivitis is a result of bacteria buildup on the teeth, causing irritation to gum tissue, okay? So gums become inflamed, discolored, and may spontaneously bleed. So when you have, basically when you brush your teeth in the morning, sometimes you feel like there's bleeding in your gums. It hurts, like when you spit and you see there's blood in the foam. So it's possible that it's either you have gingivitis or you're brushing too hard. Okay. And then other than that, the signs and symptoms of gingivitis would be bad breath, sensitivity to heat and the cold, and also tenderness and pain, or like discomfort in that area specifically. So in the next picture here, you can see the uh,
perfect.
sorry, you can see the dental biofilm, right? So this
Mm-hmm.
one, um, we normally have biofilm because of the bacteria and stuff like that. But then, so when there's too much of it, that's when there's an issue, basically. Okay, so we go to the next slide. Okay, so there's actually a lot of pictures under that. If someone can kind of move the pictures, is it possible?
Um, could we move the pictures or it's not possible? I'm not sure if it's possible.
Okay. Um, It's okay then, because the thing is the other pictures are all like the stages of different, but it's okay. So this one you can see here, this is all the accumulation of plaque, um, accumulation of hardened plaque basically in our teeth. So this person probably did not brush their teeth for months or for weeks even. So that's why there's this huge accumulation here, and then there's also some staining. So this one, um, it can get to this stage if you don't come for dental cleaning for maybe 5, 6, 10 years, especially if you brush your teeth every day, right? So you won't get this kind of accumulation very fast if you brush your teeth every day. But there are some people who can get this. And that's why coming to the dental clinic is very important. So we can clean this and you won't get gum disease.
Okay, got it.
Yeah. All right. So wait, I think there's yeah, okay. So periodontitis next. It is a chronic long-term inflammatory disease that affects the supporting structures around the tooth, right? So just now gingivitis, it affects the gums. So
Mm-hmm.
periodontitis, it affects the bone tissue and the gums, basically. And then bacteria and other microorganisms stick to the first surface of the tooth, right? And in the pockets surrounding the tooth. So basically, the inflammation causes bone loss. And then when there's bone loss, the gums become flabby. And that's when the plaque becomes, they are able to stick to lower parts of the tooth and get to the root, and then it causes more inflammation, and then it's just basically a cycle going on, and then you get mobile teeth at the end of the day, right? So basically these pockets, right, it's formed because of bone loss. Okay, so and then because the bone loss causes your teeth, your gums to be flabby, and then you have a pocket formation between your tooth and the gums, as you can see in the picture here, the
Mm-hmm.
periodontal pocket. Yeah. And then so usually this one can develop from pre-existing gingivitis, right? And however, not every case is gingivitis. Not every case of gingivitis can develop into periodontitis. It's just that some people are predisposed to these things, especially if they keep um, having these plaque in their mouths, and then they don't come and do a cleaning basically every year and all that. They just leave it there for so long. All right. So yeah.
Okay, great. Next slide, right?
Next slide. Yep. So you can see here the difference between mild and moderate to advanced. So you can see how, okay, there's like plaque. And then with the advanced one, there's like more plaque. The plaque can go up to the root surface because of how the bone now is gone. And then there's receding gums and there's bone loss, right?
Mm.
Okay, so yeah, next slide. So these are the few examples of periodontitis. So these are not pictures that are taken by me. I took this from the internet and it's just for educational purposes. All right, just a disclaimer. So you can see here, the roots are showing, and then the gums are reddish, inflamed, and then you have these shifting of teeth. All right. So with this, we with these cases, right, you tend to have bad breath also at the same time. You have definitely will have mobile teeth, and then you will also have bleeding gums, sometimes gums that are in uh, with abscess, with pus coming out of it, and then there's also some pain.
Okay, got
Yeah.
it. Looks scary.
Yeah, it is. So this one is even, yeah, more scary. So this
Mhm.
one is basically a um, very bad case of chronic periodontitis. You can see how there's swollen gums, and then you have the teeth which are mobile, also showing roots and all that. So a lot of the time, gum disease is painless, right? So people
Mm.
don't realize that they're having it. So for example, like gingivitis, you might have gingivitis right now, even if you haven't had a scaling done for maybe 1 year or more. So it really, that's why I keep saying you have to go to the dentist, for checkup and all that.
Yep,
Okay.
absolutely agree. So if you go for checkup every 6 months, hopefully you don't end up like this lah. That's the
Yeah.
moral of the story, right?
Yeah.
Okay.
Basically.
Yeah.
Okay, so the next slide, we can see here the progression, right? You have healthy gums. You can see how, okay, you have the bone here in the x-ray. It's at a good level. It's right at the crown, at the root, but well, at the, how do you say, it's at the level between the crown and the root. Okay, and then in gingivitis, the bone level is still okay. And then in early periodontitis, you can see a slight dip in the level of bone. Okay. And then in moderate periodontitis, you can see it gets lower and lower. It goes further away from the crown if you notice the bone level, right? And then
Hmm.
in severe periodontitis, you can see how it's basically right at the tip of the root, right? So that's why our tooth starts becoming mobile. And after that, it will shift also at the same time.
Got it. Okay.
Yeah. So what are
So
the
this
causes? Yeah. Um, so, what are the causes of gum disease, right? We have plaque on tooth surfaces causing calculus, forming calculus. And then you have smoking and betel nut chewing. And then diabetes, there's also genetics and changes in hormones. Sometimes, when in pregnancy, you can also get abscesses in your gums and gingivitis, right? And then you have stress. Then, side effects of medication also can be a cause, and systemic diseases that lowers immune system can also cause gum disease.
okay. Got it.
Yeah. So also here, did you know that blood and cardiovascular system can be affected by oral health? So there are actually a lot of research, yeah, linking gum disease to a few heart diseases and even diabetes. All right. So that's why our dental health is an important part of our overall health, and we need to care for it.
So
Yeah,
gum disease affects the other disease. So we need to take care of
it
the
can.
gums. Oh, it can. Okay.
Yeah,
Got
it
it.
can.
All right. So that is gum disease, right? We're going to go into bad breath, which sounds like a lovely word, halitosis, right? But it's actually bad breath. So, what can you share more about it and what causes it and if there's any solution?
Okay, so basically halitosis, right? The what causes it? So halitosis, what it is just bad breath, right? So everybody, sometimes we get some bad breath. Sometimes we don't notice it. Sometimes we notice it ourselves, or other people tell us that we have bad breath. Okay, so what causes it, right? It
Mm,
can be caused by plaque buildup in the mouth, around the teeth, because of the food, and also it can be caused by dry mouth. For example, back, not done.
okay, sorry.
Yeah, so it can cause by dry mouth, and then also infections in the mouth. Like, for example, if you have gingivitis, you have bleeding teeth, bleeding gums, right? So when you brush your teeth, it suddenly bleeds, or sometimes when you don't do anything, your gum bleeds, and that can cause the bad smell coming out from your mouth, right? And then also, other than that, you have tonsil stones, the back of your throat, right? That can also lead to bad breath, right? So in the next slide, you can see here, 1 minute. Let me just enlarge it on my side. Okay, so
Mhm.
in dry mouth, right? You have lack of saliva. Okay, so this can be caused by, in older adults, you have some medication or some symptoms that can cause you to have dry mouth, and this is one of the causes of bad breath. So that's why we need to drink more water. And there are also some oral gels that can help with this. And then, other than that, it's like your bacteria in the tongue. So when you brush your teeth, right? Um, I think the last step is to brush your tongue. So I hope uh, a lot of you guys, I hope all of you guys brush your tongue also at the end of the session. But there are some people who don't brush their tongue thoroughly. That's one of the causes of halitosis, basically, right? Morning breath. Um, and also, like, okay, so morning breath, when you wake up in the morning, you have dry mouth, right? So it basically is hand in hand, right? If you don't have saliva in your mouth, that's when the bad breath comes, and then because of the bacteria, right, it multiplies, and then that causes the bad breath, basically. And then there's also infrequent flossing, so that's why I said earlier you need to floss your teeth together with your brushing. And then also gum problems, and then diet. So let's say if you had some Italian food, that's high in garlic. You can get bad breath from that. So that's why it's maybe advisable to brush your teeth after eating. And then also tooth decay. Tooth decay can cause bad breath. So you need to brush and you need to floss and all that. And then you have, yeah, basically infrequent brushing also, leftover food particles and plaque buildup can cause all these things. So yeah,
So those are the causes. Okay,
yeah.
fantastic.
So
Uh,
bad breath can be prevented by brushing, by mouthwash, by drinking, by hydrating, basically. Yeah.
mhm. Okay, got it. I think that's great because I always wondered. In fact, how many of you guys actually brush your tongue? Let us know because I didn't know. So I'll start brushing my tongue. Thank you so much, Doc.
Yeah,
Okay,
that's
next.
actually. Oh, sorry.
Okay.
Before I move on, so there's actually this utensil, right? They call it like a brush for your tongue. So it's like a plastic thing. So what they do is they scrape their tongue with it, so it kind of reduces the bacteria or whatever substances that's on your tongue. So it can maybe slightly reduce the halitosis that you're having, or you can also use mouthwash. I think Listerine is probably enough. Sometimes chlorhexidine is okay too. Yeah,
Got it. Awesome.
yeah,
Thank you, Tom. So
right.
that is bad breath. And then one of the other things that older people tend to face is tooth wear and sensitivity, right?
Yeah.
Mhm.
So tooth wear, okay. So tooth structure will wear off after many years of chewing and grinding. That's basically our wear and tear. Like how we have a car, and then over years the car will go through wear and tear. So it's the same as our teeth, right? After many years, as we get older, many decades, our teeth, we use it to eat, we use it to chew, and all the kind of things. It will undergo some form of wearing and wearing off of the enamel and all that, right? Next slide.
Mhm, mhm.
So other than chewing and all that, it can also be caused from acidic food. Like if someone is particularly um, obsessed with acidic food, like let's say
Meat,
iced
heavy
lemon
food.
tea,
Oh,
like
okay.
iced lemon tea and all that kind of things, like juices, right? It's very acidic. It can
Mhm.
cause your enamel to thin out, right? And also, there's also like GERD, which is gastroesophageal regurgitation disease. That's
Mhm.
basically when you regurgitate the acid in your stomach out into your mouth. So some people have that. And this one will cause some erosion from the inside of the from the back of your teeth, basically. And then there's also bad habits and wrong brushing technique, which can lead to sensitivity and causing discomfort in your daily lives. So in these pictures here, you can see how there's some form of lesion right on the teeth. You can see how it's less like a how to say, like a cavity there, right? So this one normally it's caused by brushing, improper brushing. All
I
right.
see.
And then the
Okay.
other side, you can see how the tooth has become shortened. And that's because of like maybe bad habit, like they grind their teeth at night sometimes. And also it can because of uh, ice chewing. There are some people who like to chew ice. So it is possible that this can be formed from that. Okay.
Okay.
Next.
Next.
Okay, so in this picture here, you can see the different types of um, wear and tear in our teeth, right? So on the first, at the top here, you can see abrasion. Okay, it's right at the part between the tooth and the gums. So this part is actually it's where the enamel is the thinnest. All right, so that's why we need to brush properly. So a lot of the time. When I meet patients who have abrasion, I ask them what kind of brushing technique they use. So they would say they brush like this. So that's actually a very bad technique because it causes abrasion. And also at the same time, they like to use medium toothbrush or hard toothbrushes because they feel like it's cleaner when they brush with a firmer toothbrush. I understand that. But the thing is, these toothbrushes are actually very, very abrasive and are one of the causes of abrasion in our teeth. All right. And also, you have here next, you have abfraction, right? So, abfraction, it's basically um, your enamel, it breaks off. So, like I said, in that area, it normally happens in the area because the enamel is the thinnest there. So, when you chew ice or when you grind at night, sometimes you can have this because the enamel just chips off, right? And then next, you have this attrition. Attrition is basically grinding of teeth. You can see how this person has ground their tooth until it's like halfway gone. All right. So uh, that's one of the causes of bad habits also. Like sometimes people don't notice it when they're sleeping. They grind their teeth or they how to say they bite. Or they clench their teeth also can cause this, right? So next you have also erosion. So erosion is caused by um, acidic substances like juices or your gastric juices, and this can cause this your tooth to erode. And finally showing the pulp layer, which is basically the layer that provides nutrients to our teeth, right? And this is what causes the sensitivity to come, the pain to come in the end.
Wow. Okay. And is this like a real photo where all this person has everything in it? It's amazing. I think. Yeah.
Yeah, no, it's very surprising to find someone who has all of this, but
All the bad
yeah,
habits, basically.
yeah.
Right?
It's
Okay.
also it's probably like from many years of doing certain things, so they can
Mm,
have all of this. Yeah,
yeah. And I think another good reason to go to the doctor, to the dentist frequently is because, you get to see all this and you can prevent it because it is habits, some of it, right?
yeah, correct.
So you want to intervene and change those habits early on.
Yep,
Okay,
exactly.
so receding gums is also another challenge, right? Could you share more what causes it? Mm,
Of course, yeah. So gum recession, right? It
mm,
happens when your gum tissue pulls away from your teeth, exposing root underneath. So that's why the cavity later on it forms later on in the root, right? So this makes your teeth more vulnerable to cavities, like I said. And then your teeth can become more sensitive when brushing or when eating as well. So let's say when you have these issues like gum recession, like in the picture, when you start eating ice cream or when you drink cold water or even when you breathe in cold air, you feel sensitivity,
mm,
so it's
mm.
because of this. All right, so next slide.
Right? Mm,
Okay, so gum recession is actually a very natural process, right? So as we age, like I said, we go through some wear and tear, so the gums will slowly recede. But the thing is, sometimes if we brush too hard, this progress may be hastened, right? It can lead to like further recession. Like for example, in this picture, you can see how this person is showing the bifurcation in the root in the molars, right? You can see how there's like two roots there. So this person is probably feeling sun sensitivity here, right?
mm. Got it. Next slide.
Yeah.
Okay.
So here, actually, this is a moving picture, but it's okay. That's why I said to prevent gum recession, we need to brush with proper technique. We should. Okay, let me just get my model.
Mm-hmm.
Uh, So a lot of people, like the older people I see, they like to brush their teeth like this. Okay, so the front part of their teeth, especially like here, the side here, they will brush it like this. That's called scrubbing. All right. So we try to tell people to stop brushing in that way. I understand it's easier, it's faster, but actually it causes a lot of harm because the thing is, it abrases your tooth, it causes wear on your gums, and that's why also one of the reasons why your gum is receding. So that's why we need to stop brushing. We need to stop brushing in that technique, um, the scrubbing technique, right? So what I would suggest is to brush in a circular way or up and down vertically. because it would be much easier on the tooth structure
Okay.
and the gums. Yeah.
Got it. So, how many of you guys are brushing the wrong way, and how many of you guys are just learning the correct way to brush? Let us know in the comment because somebody earlier said, I'm going to start brushing my tongue now, like, also like me. So, it's okay. This is where we're learning. Okay. Let us know in the comment. Right. So, this is, I did not know the wrong way of brushing is actually the cause of receding gums. I
Yeah.
didn't think. Yeah. Okay.
So that's why I do see a lot of patients. They come in, they have these, not even like senior patients, right? They have
Yeah.
like younger people having these recession because of how they brush their teeth, because they're obsessed a little bit with clean teeth. So they use really hard toothbrush, and then they just scrub at their teeth like that, like pushing it really hard because they feel like they feel there's something there, right? And then they want to remove it, so they brush harder. Well, actually, it's causing these
Worse.
problems, right? It makes things worse, right? So that's why if you feel like there's something there, you just come to the dental clinic and maybe we can give you like a scaling and stuff like that, right? It will help at the end. So yeah.
Awesome. Okay, so this is another challenge that as we age, our teeth starts getting more and more yellow. Why? Why is that? Because I'm noticing it as well, and I'm like, freaking out, right? So why
Yeah.
does this happen, Doc? Help us.
Okay, so the thing is, yellow teeth, right? It's very natural. Okay, so not everyone's teeth are supposed to be white. So different people have different colors of teeth, right? It's like a whole range of shades. So, what causes the shade is basically our enamel. Okay, so some people have a thinner enamel. Some people have a thicker enamel, and then also at the same time as we age, as you know, the enamel wears off, and then it will become thinner and thinner. Okay, so the enamel layer is actually kind of white and then this kind of transparent. So some people who have yellow teeth, like younger people who have yellow teeth, they may have a more translucent enamel, showing the dentin inside, which is yellow. So that's why their teeth look more yellow. And
Yes.
then yeah. So whereas for seniors, right? So their enamels wear off, and that's why it's showing more of the dentin layer. That's why it becomes more yellow. So that's why I'm saying it's a very natural progress as we age.
Mm.
Yeah.
Okay, thank you. At least I don't feel so traumatized because I thought the yellow was stain and not because of the dentin inside. Okay, now I
No,
can.
sometimes it could be because of a stain, right? So
Uh,
yeah.
but
So
I'm
as we
pretty sure I don't drink the staining stuff. But never mind, still good info. So yeah, yeah.
Yeah, so the thing with staining is like, because no we have our teeth for many years, right? So we drink, we eat, okay, we eat like curry, we eat spaghetti, all this kind of like colorful food, right? So these food, they have um um staining properties. Okay, so these food later on will stick to your teeth sometimes, and then this when it sticks to your teeth, it causes a stain to form. And then as you go on with life, the stains get more and more, especially if you don't go for scaling. The plaque buildup and all the kind of things, the stain, it gets bigger and bigger, and then you can see flecks of dark spots on your tooth, right, in the back of your tooth, especially in coffee drinkers,
Mm,
tea drinkers. So you can see that, and then that's why we advise people to come in for dental cleaning once a year at least. So yeah,
okay,
the
got
next
it.
slide. Oh,
Yeah,
the next slide here. You can see
yeah.
here, on this person's tooth, you can see some staining here. This is possibly because of coffee, tea, smoking. We don't know, but yeah,
Mhm.
that's how it would look like. And then on the next slide, so the causes, right, of stain, you can see, it can be you can have a discoloration of your tooth because of trauma. For example, if you fell and then you hit that tooth and then that tooth dies. So that is basically trauma, right? It can cause your tooth to discolor. And then you have old amalgam stain. So a long time ago, people, maybe nowadays also, people still use those fillings, the metallic fillings. So these will stain your tooth black. There's also smoking. there's like tar stains on your teeth basically. So this one you can see male smoker age 50, right? So this person probably is a chain smoker. So this is how it would look like if you smoke a lot. And then you have coffee and tea stains. This one can be removed with scaling or whitening. And then you have gum recession exposing darker root. So our root, as you know, it's underneath our gums. So when the gums are exposing the root, you can see it becomes more yellow. So some people would think it's actually uh, that their teeth are turning yellow, but it's actually because of recession. All right, and then you have the dark tooth from root canal treatment. So root canal treatment, it can cause your tooth to discolor, and that's when you would consider to wear to have a crown fabricated and put on that tooth.
Okay.
Yeah.
All right. So now we're looking at tooth loss, right?
Yes. Yeah. So,
Mm,
okay, tooth loss. As people age, the likelihood of losing teeth increases due to decay, gum disease, or injury. And tooth loss can affect nutrition, speech, and self esteem. So, I know that some people they don't really care about it, some people do, especially when they lose their tooth. So you can see in these pictures here, right? You can lose one or two, and then as we age further and further, if we don't take care of our teeth, we lose more and more of it. Yeah, you can see, and this old lady basically has no teeth.
okay.
Right? So, what are the consequences of tooth loss? You can see here difficulty in chewing and eating, limiting your dietary choices. Like, for example, if you can't eat hard food, you have to have porridge all the time because you don't have teeth, right? You can't chew. And then you have speech problems. Sometimes people who don't have teeth, they can't really articulate their words properly, and they can't form words well, and then like it sounds funny. And then bone loss, you have bone density in jaw, it reduces as the bone undergoes resorption, right? And then you also have shifting of teeth. So you can see in the picture here, this person probably has lost that tooth for a while now, and then the upper tooth, it over erupts. It tries to fill into the gap at the bottom. So it doesn't only happen for the upper teeth. It also happens in the lower teeth. Like for example, if you lose your upper tooth, the bottom tooth would over erupt to fill in that space. And also the side, the adjacent teeth, right? It would tilt or shift sideways like that into the gap. Okay, and also with tooth loss, it can cause changes in facial structures. For example, if you have a lot of tooth loss.
Mm.
Yeah.
So it happens like this.
Yep, you can see in this picture here. So facial appearance with healthy teeth and bones, you can see how the profile is nice and stacked. And then when you have a facial appearance after tooth loss here, this is, let's say, in the beginning stages, the first few years of not having any teeth, right? You can see how the mouth is hollowed inside, and then the
Mm,
cheeks start to hollow later on. Okay, you see here the facial appearance of the tooth loss and bone loss. Because the thing is, when we don't have teeth, the gums, no, the bones, they resorb, right? They become thinner and thinner, and then your jaw also becomes shorter. It goes upwards a little bit like that because of the lack of teeth, the lack of support there.
okay.
Okay.
Not cool. And
Yeah.
then another aging problem, I think, is denture problem.
Yeah.
Dentures is, of course, gigi palsu, but how do the dentures cause problems?
Okay, so you see how so when we lose our tooth, right? We want to have a denture. Okay, so some people have dentures, some people have crowns or bridges. Okay, so let's talk about dentures. So dentures, it's false tooth. Okay, false tooth, gigi palsu, gigi batu, the other
Mhm.
names. So when the tooth loss occurs, okay, you need dentures to be placed there so we can chew, we can eat properly, right? And then so unfortunately, sometimes the dentures may be ill-fitting, right? And then it can become loose over time as we age because of the bone resorption and all that. And then after that, when it becomes loose, it needs to be replaced. So it is very important that we get used to it because I know that a lot of older people, when they have their dentures made, they get used to their old dentures that they have been wearing for decades sometimes, right? So, and then when it becomes loose and they cannot use it anymore, even with the glue, with the denture glue, it still becomes loose. Um, they definitely need dentures. And when they are made to use dentures, new dentures, they have problems. Like in the next slide,
Right.
you can see here when they have new dentures, it is uh, they can possibly get a few of these, like for example, sore spots in the gums during wear or eating. So this one, um, when you have new dentures, right? This happens because the dentures could be overextended. So we need to come in and we need to get it adjusted. And then also when it's not fitting properly, right, it can cause a formation or formation of ulcers in the gums. Basically, ulcers are like lesions on your gums that are very painful. And then you have difficulties in speaking clearly, like if the dentures are too thick, or it's not properly fitted. When you speak, it could sound funny when you try to speak with them. And then also loose dentures, let's say if the dentures were not like, maybe there's like a misstep during the fabrication of the dentures, it could cause these loose dentures. And then there's also burning sensation when you're wearing it. This one is also because of the denture being too long or in some sections. And then you have pain in the jaw joint when you're eating especially. And then tongue and cheek biting. This is because the tooth is probably too wide for the face, right? Okay, and then you have difficulties in swallowing because the denture is overextending to the back of your throat. And then you have gagging and nausea also because of that. And then also there's fatigue in the cheek muscles, probably because the dentures are too high. So these are one of the common denture problems. And that's why when we fabricate dentures, right, at the clinic, we take a lot of time, especially for older patients when they don't have all their teeth there, because we need to make sure that it is perfectly seated in their mouths.
Okay. Oh, it's going to cause a lot of problems.
Yeah.
Okay. Wow. Okay. And next, that was denture problem. I
Uh,
guess next is TMJ disorder. What is that? I only know
so
the Makota Joho, I think, the TMJ. Okay.
Okay, so TMJ is it's short for temporomandibular joint. Okay, that's a TMJ, and then you have TMD, which is a temporomandibular joint disorder. Okay, it is a general term to describe several conditions of pain and dysfunction of the chewing muscles and the temporomandibular joint, the joints which connect the jaw and the skull. So basically, this joint here, which is like a hinge joint where we used to open our mouth and close our mouth and we talk like this. Yeah, so that's the joint that controls that. Okay,
Okay.
next slide. Usually, this pain is not harmful and affects maybe one side of the jaw, sometimes both sides. Okay, and then in general, patients with TMD may experience one or more of these symptoms, right? You have jaw pain or soreness that may be worse when you wake up at night. Um, Jaw pain when biting, chewing, or yawning, clicking from your jaw joint when you move it, stiffness or locking of your jaw joint, earache or ringing in the ears,
Mm-hmm.
difficulty in opening or closing your mouth sometimes, and then also headaches. It can also come in the form of a headache. All right. So TMD, the next slide, you can see what causes it.
Mm-hmm.
The exact cause of TMD is not well understood. So many studies show that TMD is closely associated with any activity that causes pain and inflammation of the joint and its muscles. Aggravating factors include grinding, jaw injury, psychological stress, um, dental malocclusion, overuse, and overextension of the TM joint also. And it can also be developed from arthritis or chronic grinding or clenching of the teeth. All right. So as we age, we know that we have a potential of getting arthritis. All right. And then also with the wear and tear in our joint and sockets, it can cause this issue.
Okay. Got it.
So in the next picture, we can see the cross section here. You have the normal joint at the top here, and then next one you have the abnormal joint. That's when it dislocates. So let's say there are some people who, when they yawn too widely, they couldn't close their mouth. So that's because of a dislocation in their joint here. Okay, and this one normally, if you go to the emergency, they will snap your jaw back in again. That's pretty easily done. But there are some people who always end up dislocating their jaw, and that's probably because of the anatomy of the TMJ, the one that I mentioned earlier. So maybe the socket is too small for the bone, and it causes whenever we yawn it when we yawn too widely, it goes forward, right? Okay, and there's also this arthritic joint here at the bottom where you can see the capsule that's covering the bone at the top there. It wears off, and that's when you feel pain.
Got it.
Okay. Yeah, next slide. Okay, so most older adults they have TMJ degeneration, which affects women more than men. In most older adults, the symptoms of TMD are mild and self-limiting and can usually be treated with self-management. All right, so it affects women more than men because sometimes women can be more stressed psychologically. Yeah, so with work and all the kind of things, they tend to grind their teeth or they clench, so this one all can cause this TMD later on.
Okay, got it.
Yeah.
And I guess this is the last one. Oh no, that we're looking into, right? Oral
Yeah.
cancer, because that seems to be another challenge that's
Yeah.
faced.
All
Hmm.
right, so the last one you have here is oral cancer. So, oral cancer is an abnormal growth of tissues in and around the oral cavity. Oral cancers, detected early and treated adequately, can prevent severe damage to the body and improve the lives of oral cancer patients, right? So, the risk of oral cancer increases with age. So, as we age, we are more predisposed to these things, right? So, oral cancer often occurs in people over the age of 40 and affects more than twice as many men as women. Okay. So most cancers in the mouth are related to tobacco use and drinking alcohol both. So that's why we advise people to avoid taking these things. So the causes you have here: smoking tobacco, cigarettes, pipes, or cigars, and then you have this tobacco chewing. I know like the olden people, they like to chew tobacco, right? And then they like to chew with this betel nut, and they have this when they do this, the pinang and sire, is that what it's
Yes,
called? Yeah,
it's
then they get yeah.
yeah.
So then they get this red color stain in their mouth. It's very bad because the thing is it's very carcinogenic. It causes erosion of your teeth, not only your teeth, your gums, your tissues on your cheek, and that's how the cancer can develop from there, right? So there's also like excessive alcohol consumption and then excessive exposure to sunlight also. So that's why you should wear sunblock every day, especially in this Malaysian weather. Yeah.
Okay, got it.
So
And which area does it affect? I guess common site.
okay, so common sites you can see here in the pictures on the cheek. You have here on the tongue. You can see here on the side of the tongue, sometimes on the underside of the tongue. And then you have the cancer on your lips. You can form cancer on the palate. And then you have cancer also right on the base of the tongue at the same time. So the gums, inside lining of the cheeks, all of these places can form cancer. Yeah.
Ah, okay, got it.
So, okay, what are the signs of oral cancer? Firstly, we have non-healing ulcers for more than 2 weeks, white patches, we call it leukoplakia, or red patches, erythroplakia. And then you have this persistent lump or growth in the mouth. Bad breath, halitosis, is also one of the signs of oral cancer. And then enlargement of the lymph nodes. So whenever you feel like you have these on the top one especially, the non-healing ulcer, I think that is one sign that you should go see a dentist, and we can see whether what your risks are and all that.
Okay, got it.
So in
And
this
this
slide here, yeah, this slide here, you can see these are the steps for oral cancer screening. You can screen yourself at home. Basically, you stand in front of a mirror, you lift your lip, and then you can check for your gingiva. and then the under the gingiva you can see your mucosa also, whether there's any ulceration, any redness or whiteness, and then you can look at the border of your lip if there's any ulcers there or any lesions. And then after that you have this buccal mucosa, which is your cheek. All right, you can pull your cheek to the side, check your both side of your cheek if there's any whiteness, any redness, ulceration also. And then you have this your vestibule around your lower lip. You have to check other than your upper lip, you have to check your lower lip. Okay, and then for your palate, maybe if you cannot see yourself, you can ask someone else to look for you. And then in the throat, you have to take out your tongue and then look at the back of your throat if there's anything there. And then other than that, you lift your tongue up to the roof of your mouth and you see if there's any bumps or lumps or ulceration under your tongue. And then also next you have the lateral side of your tongue. So you can take out your tongue and then you move it from side to side and see if there's any lesion on the sides of your tongue.
Okay, got it. So that's how you
Yeah.
check, doc. All right.
Yeah.
So all this is pretty scary with the pictures and all.
Yeah.
So there's a lot of things that can actually go wrong as we age with our teeth, right? Can it be prevented? If so, how?
Yeah, so prevention is by prioritizing your dental health, basically. So each person can enjoy strong, healthy teeth throughout their lives as long as they prioritize their dental health. Yeah, so next slide. Uh, So overall, maintaining good dental health requires proper and consistent oral hygiene practices, brushing your teeth, flossing your teeth, and then you have healthy lifestyle choices. You have to avoid eating sugary food, avoid tobacco usage, avoid alcohol, okay, and then go for regular dental visits. So taking care of your teeth is the key to your good health, basically.
Okay. And I think a lot of people assume that brushing the teeth is enough, but from what I'm hearing from you, flossing is also important and brushing the tongue. So those three is what good oral hygiene is. Is that right?
Yes.
Or you want
Yep.
anything else to add?
Uh, well, visit your dentist every year.
Yes. Visit your dentist every 6 months, right?
Once a year, every 6 months is okay. Once a year, minimum once a year.
Okay, got it.
Yeah.
Cool. So let me check if there's any more
The next
slide.
one.
And yeah,
Yeah,
so
last one.
lastly,
So the last one here, okay. So sometimes oral diseases may not cause any pain or show signs that you can easily see until the disease has reached a more serious stage. So basically, like I said, from gingivitis and all that, sometimes oral cancer, you might not know it's there because it might not show any, no, it might not cause any pain. Like for example, gingivitis can not show until like when it's like very painful, right? So you could be having gingivitis right now, maybe like 2 years later also still gingivitis, it's still there. So that's why it's very important for you to come to the dental clinic for us to check and to see what you have in your oral cavity if you have any of these diseases, basically. Yeah.
right. Okay, got
Yeah.
it. Thank you, Doc. So if we were, so that's the end of the slide, right? So if we were to summarize today's topic and what we discussed, what would you say is the key important thing that we should keep in mind? Especially about dental healthcare as we age. And if you have one message for the audience out there, what would it be?
One message I would say, brush your teeth with proper technique twice a
Mhm.
day, every day. And floss. Try to incorporate flossing into your routine, and also
Tongue brushing
visit your dentist every year,
and
at
tongue
least
brushing
once a year. Sorry?
and tongue brushing.
Yeah, and also tongue brushing.
Yes. A few have agreed. Okay, I'll stop brushing my tongue now. Okay, fantastic, Doc. It's been super insightful. I learned a lot, and I think I'm not going to take things for granted. And it's really important for us to know and understand because we now have parents who are aging, and we can help them take care of their health, dental health as well, right? So now I think we're going to go into our Q&A, right? So I have to say that this is probably the episode with the most questions we've got. like 25 questions, right? And it's already 4:10. So, Doc, if we can go through them very quickly, then we'll go to the quiz and then we'll go back to here. Okay.
All right,
And we have a
sure.
lot of fan here. There seems to be like serial questions from one person or two kind of thing. All right. So, Jesse Liu's question is, I brush twice, 3 times a day, floss, gargle after eating, but still have dental problems. Why, doc? This is a good question. I tried
Okay.
asking what the problems were so we can fine tune it, but I haven't seen any. But, doc, could there still be a problem? Why?
Okay. So why there are some people they have thinner enamel, so it's weaker compared to others. There's
Mhm.
also maybe because you're more predisposed to cavities and all these kind of problems, all right? So there's also probably because of your brushing. Maybe you're brushing too hard, it's wearing off the enamel, and also maybe um, you're brushing 3 times a day. So during lunchtime, do you immediately brush your teeth? Because the thing is, when you eat, right, there's an acid forms when you eat, okay, because of the bacteria and stuff like that. So it is recommended for you to not immediately brush your teeth, right? Because with the acid it causes erosion. So when there's acid on your tooth, your enamel is weakened. So when you immediately start brushing your tooth, it kind of wears off the enamel afterwards. So that's why when you after you eat, instead of immediately brushing your teeth, maybe rinse your mouth first, drink a lot of water, maybe rinse with you can use Listerine or any other mouthwash that you prefer, and then you can start brushing your teeth. And you brush your teeth gently, don't brush it too hard, and then you floss. So yeah.
All right, fantastic question there, Jesse. Thank you so much. I think we understand it better because some people have thinner animals or more prone to certain things. Next question is from Judy Chalk. I experienced gum infection and have to extract a few tooth as it caused my teeth to loosen. What causes gum infection? I think we covered this, but very quickly, Doc, what causes gum infection?
So what causes gum infection is because, like I said previously, is because of a plaque. When there's a lot of deposition of plaque of the biofilm on your tooth, the uh, it causes some inflammation on your gums. All right, the plaque, it interacts with your gum, and then your gums basically it becomes inflamed because of that, and that's how your bone loss it becomes more and more, and that's how your tooth loosens up. So um, that's how gum infection is formed, right? It's because of the plaque. The plaque causes an infection of the gums, and then basically it's there's like a metabolic. Um, no, it's not metabolic. It's what you call it. Like your gums are basically reacting to this plaque because it's trying to
Mhm.
protect you from this bacteria overload. Yeah,
Okay,
so that's
and
why.
therefore that's what happens. Got it.
Yeah.
I hope that answers your question. Next question is from Maju Inder. Is it safe to take apple cider vinegar? Does it damage the tooth?
Uh okay, so apple cider vinegar, it's sour, like it's acidic.
Mm-hmm.
Um not okay, I think some people they do this because they follow some holistic practices. I would suggest maybe try not to, because there haven't been much research about apple cider vinegar helping teeth much, or your gums. So if you can take apple cider vinegar, but don't gargle it. There are some people when they drink, they keep the drink in their mouths. They keep it like this, and then that's when the acidic solution, it stays on your teeth for a longer time. So we don't want that. If it's possible for you, you can just drink it one shot if you need to drink apple cider vinegar, or if you're drinking a more acidic drink, try to use a straw so it avoids your teeth, basically. And then you just gargle and rinse with the mouthwash later on.
Got it. I think some people who say drink ACV, they
Yeah,
also mention use a straw just to protect your
yeah,
teeth. I think.
yeah.
Okay, so Rita has a question. Do we have fever when we have toothache? Any infection like that?
Um, okay, so it can come with fever. Like there are people who have, because of the tooth infection, they develop a fever. So it is possible for it to you get a fever for from that. So that's why when you come in, I normally get patients who come in. They feel warm, like the night before. They feel really warm, especially when it's very active pain. So they take Panadol, they take painkillers, and then the fever goes down. So it is possible that you can get fever when you have dental pain. Yeah,
Okay,
dental.
got it. I think I'm going to combine the questions because they're all from Rita. Diabetes apparently leads to tooth decay. Can it be cured? So that's one. Is there any particular toothpaste that can whiten the teeth? That's another one.
Okay. So about the diabetes one, right?
Uh-huh.
So you're asking for a cure for diabetes or a cure for the dental decay?
I think it's the cure for the dental
So
decay.
so
But
there's
it means take care of your sugar.
yeah, yeah, you just need to take care of your sugar intake. So you can't really cure dental cavities. You can fix it basically. So like dental cavities, it's a formation of a cavity in your tooth. So when it's there, the only thing we can do is to stop it from progressing. So that's why we remove the softened um, tooth structure, and then the infected tooth structure, right? And then we fill it up, and then we rebuild your tooth. Okay, so there's no cure for it. The only way is to prevent it, which is to avoid sugary food and to brush your teeth.
Mhm.
Yeah.
Basically, don't have diabetes. Okay. And the other one is, our teeth becomes yellow. Why you sort of covered it? Is there any particular toothpaste that can help whiten?
Okay, so the toothpaste, right? I know in the market there's a lot of toothpaste. You have like charcoal toothpaste, you have toothpaste that's like purple in color. So
Mm-hmm.
bear in mind a lot of these toothpaste that say that they can whiten your teeth, they're very abrasive because what they do is when you brush your teeth, it's mechanical, right? So what it does is like it's mechanical whitening. It removes like the plaque and stuff like that. So it can wear off your enamel more. It can cause more sensitivity. So you have to be careful with these toothpaste. Um, you can try them. I won't stop you. You can see which one helps. But I think if you really want, for aesthetic reasons, if you want to whiten your teeth, the best way is for you to come to a dental clinic and we can help you whiten your teeth. There are several dental clinics nowadays that offer teeth whitening. So you can just come in and you can ask for a package and see what they have.
Okay, sounds good. Okay, so
Yeah.
Rita has another question, but we're gonna move on to somebody else so that everybody gets a chance. Is it normal to notice gaps between the teeth after scaling? This question is from Ainun Nadira, and I think this question is really important. Is it normal to notice gaps between teeth?
Okay, so the thing is, we notice these gaps because previously, before scaling, our gums are inflamed. Okay, so that's why it's swollen. It's a little bit swollen. It's not too bad, but it's swollen, so it covers the gap. So when you start scaling, and then after a while your gums they become less inflamed and then they become less swollen, and that's why you see the gaps. So actually it's normal, but if you notice that it's wider than you're happy with, then you can go to your dentist and see what they can do for you about it.
Okay, got it.
Yeah.
Next question is from Jessie Liu. Is there any cure to reverse periodontitis?
A
Is that right?
periodontitis.
Ah,
Okay, so
any cure?
uh there's no cure. The thing is we can try to stop the progression. So the thing is with periodontitis, right? You come in, we do deep scaling. So basically, how we do the deep scaling is like the normal tooth scaling, but the thing is we go in deeper because there's pockets, right? We try to clear out all the plaque, we clear out all the um, the calculus that's on the root surface, remove the bacteria that's present over there, and then we see um, how the bone level is like. Sometimes, okay, let's say if you want to build up the bone level, we will normally refer this person to a specialist, uh, what do you call this? Periodontal specialist. So they can do a bone reconstruction through surgery, or maybe they will put some um, this I don't know how to explain it, but they have this thing that they put like a collagen or something like a graft they can put on the bone, and it can help reverse it a little bit.
Which is actually her question: what causes bone loss? How to gain back the bone loss? So I
Yeah.
guess
You
that would be the answer for the
The
question, right?
gain back, well, on your own, you can't gain back the bone loss. But let's say if you want to save that tooth, for example, and you want to have the reconstruction done, you can go. We can refer you to a specialist, which can help you with that, and they will assess you later on if that is possible.
Okay, got it. Sounds
Yeah.
like certain things are the point of no return, kind of
Yeah.
thing. A fantastic question from Yiki: do I floss or brush first? I always thought this was chicken and egg. Is it?
Yeah, you can. Okay, it depends on what you find is convenient. If you feel like flossing first is better, or you feel like brushing first is better, it's fine. I heard that flossing first is better because you release the bacteria that's from
Mhm.
the sides of your teeth out, and then you can brush it away later on. So maybe you can floss first and then you can brush, or you can brush first and then you floss. Either way,
By the
it's
way,
it's up to you. Yeah,
okay,
as
got
long
it.
as you do it.
A follow-up question is it normal if it bleeds whenever I brush? Good
Yeah,
question.
so the thing is, we brought up earlier on, when you brush your teeth and then suddenly it's bleeding, it's possibly because of gingivitis. And also it is possible that you're brushing too hard, or you're using very hard bristled toothbrushes. Yeah, so you need to lay off the pressure. Also, maybe you can check in with your dentist and see maybe you have gingivitis, and then maybe you need to have a dental cleaning done. Or maybe you can maybe what else the dentist might do to you, maybe prescribe you a mouthwash that could help. So yeah, so that's why, as I said, it's very important to see your dentist.
All right. I think for now we still have 13 questions, but let's go to our quiz, kind of thing. Hang in there. I think we've got enough questions, but definitely let's go into the quiz. Now, let's take a look. What do you need to do to win? First, you got to be sure that you share this video out at least 3 times, and remember to set the share post to public so that everyone can see. Next, answer the 3 questions that we're going to be showing on the screen in a single comment, and you are on your way to win prizes. So let me repeat that. Share this video out 3 times. Remember to set the post to public so everyone can see. Secondly, answer 3 questions that we're showing right now on the screen in a single comment. Okay, all you have to do is just answer once, and then we will pick out the winners based on the correct answer. All right. So are you guys ready? Let's proceed. The first question is: receding gums are a natural part of aging and do not require attention. True or false? Receding gums are a natural part of aging and do not require attention. True or false? Question number two: regular dental checkups are not necessary for aging individuals. True or false? Regular dental checkups are not necessary for aging individuals. True or false? The last question is: aging individuals are less prone to tooth decay. True or false? Aging individuals are less prone to tooth decay. True or false? So while we're waiting to see who our winners are, let's go back to the Q&A. All right. So Doc, let's take a look at the next question. Is there any food that we can take to make our teeth stronger?
Okay, you can drink milk. Milk is okay.
Okay.
Yeah, that's one, because it helps with gives you calcium and all that.
Mhm.
Make your teeth stronger. Mm, yeah, I would say milk is the top, the most, the the top food basically. So other than that, uh, hmm, not
That's
anything that comes to mind, unfortunately. Yeah.
okay. So another question is, why do we have tooth tartar, and how and what is the best solution towards it?
The tartar um, is something that is formed naturally, so you cannot really stop it. But you can't. But you can reduce it um, by brushing it with a proper technique. So let's say, like I said earlier on, you need to brush in a circular motion, and then, like for example, in the inside. Okay, let me show you on this model here. So on the inside here, we tend to get the tartar here, right? The accumulation here. That's because our tongue is laying on it, right? So what you want to do is you want to brush it outwards like this. You cannot see. Okay, so you want to brush your tooth outwards, and then you brush um, for at least 2 minutes, all the whole your whole mouth, brush for at least 2 minutes, and then you brush with precision. You don't just simply just go around like that, right? You want to make sure that the toothbrush goes into the crevices, and then you brush it outwards. So that one would reduce the tartar. And then other than that, if it's too much, then you have to go see a dentist to get it cleaned at the clinic.
Okay, got it.
Yep.
And a question from Aino Nadira is, lately I've been seeing a lot of people using dental patch. It's back to the whitening of the teeth for a while. Do you think it's a good idea to use it, in your opinion, professional opinion?
Okay, so I think this dental patches is like the whitening patches, right?
Mhm.
So I've seen a lot of it online. You can get it easily through Shopee and other places, right? So if you want to use it, you can. Just note that these things can cause sensitivity. Like for myself, I did try to use it on my own, and then I noticed that within 3 days, like because I was using it from Monday, Tuesday, Wednesday, right? Like 3 days consecutively. On the third day, I start feeling sensitivity in my teeth. So I just completely stopped it. So that's why you have to understand the chemicals in those patches, in
Mhm.
those strips. It can be very, um, how to say, abrasive, or it's very strong. So it can cause you to have sensitivity later on. It can cause gum problems. So it's best to use it at your own discretion. But if you want like a professional whitening, you can come to a dental clinic for that, which
Okay,
is a
got it.
bit safer. Yeah,
Okay,
at
I
least,
think
yeah.
so too. Okay. So thank you for that. We actually have our winners, but I'm just going to go through three more questions so that we can cover a lot. So the next question is from Tan Q Singh. I had pain around my gum last month, tender upon touching. I went to dentist. Dentist did cooling. Is it normal because I'm currently pregnant? Great question.
Sorry, dentist did what?
Cooling
Scaling.
means, oh, sorry, is caling, not cooling. So scaling lah kot. Is it
I
normal?
think it's, yeah, I think it's scaling.
Mm,
Currently pain around my gum. Yeah,
mm,
so like I said earlier on in the slides, pregnant women, you have fluctuation of hormones, right? So it
mhm,
can cause some formation of it can cause tenderness in your gums. It can also sometimes cause these like bumps on your gums. So that
mhm.
it is like normal for some people. So that's why probably why your dentist did scaling. So hopefully it's better now. Otherwise, you might have to go back and talk to your dentist about it.
All right. Two more questions. One from Rosida. I had wisdom removed a few years ago, but sometimes I do have pain at the area. It's like lymph node swelling around that area. Why, doctor?
Okay, so this is a bit complicated, right? So sometimes, okay, if you have that removed already a year ago, so it should have been already healed. So, does it come with fever? Is it just pain in that area under your jaw here? Does it hurt here? So these things, I think you might need to go to your dentist and see what it's about. Maybe there's some issue over there that they can see better than me, because I can't really see and I can't really exactly explain or help you in, if I can't see it myself.
All
So
right.
yeah.
So I think it'll be good for you to have a look and check with your dentist why it's still causing pain there, because doc can't see what's happening. So better be safe and have it checked out. All right. Okay. I do have two more. So Ara Deva Harun's question is, hi doc, may I know if mouth ulcer also is a sign of poor immune system?
um Mouth ulcer, okay. Hard to say. It's hard to say because um, mouth ulcers, right? It can be caused by abrasion, like or when um, we accidentally bite our cheek or the gums, the area, the mucosa, and then
Mhm.
also it can be caused by dry mouth, So, can it be caused by pure immune system?
Poor immune.
Maybe,
Mhm.
maybe. So that's why it's best if you can go talk to your dentist, see what other symptoms are causing it. Maybe it's pure immune system, a poor immune system. Maybe it's something else. So just come in and we can take a look.
Okay, got it. And the last question that we're going to look into today is by Nortiana. Any criteria when to start using denture for elderly, which I thought was important.
Okay, so when to start? As
When to,
if you're
when to get a new one, when to replace, if that's also another important question, right?
Okay, so when to replace it is when you feel like it's starting to be loose, like when you try to talk or when you open your mouth, it starts falling out. So that's probably the sign of getting a new one. So this one, when to start using dentures for elderly. Actually, when you lose your teeth, you should start wearing dentures already, right? But I
Right.
know that some people they don't want to. But once it starts causing problems for you to eat, you aren't able to bite on that side where the tooth is missing, then you should consider getting dentures made.
Okay, got it. Awesome. So now
Yeah.
let's find out who our winners are. But before I reveal to you who our winners are, let's go through the quiz questions and find out what is the actual answer. All right. So let's have a look at the questions, which is already online. So the first one is, receding gums are a natural part of aging and do not require attention. Doc, true or false? Receding gums.
The chewing gum's a natural part. Okay, so it is false. You do require attention for this. That
Awesome.
is
So false. Regular dental checkups are not necessary for aging individuals. Doc, true or false? We heard you say so many times.
okay. That is false. You need to go for a checkup, definitely.
Aging individuals are less prone to tooth decay. True or false?
That is also false.
All right. So the answer is false, false, false. And the winners for the quiz are Xiao Pan, Alice Ping, and Azlina H. Congratulations. All right. Kind of thing. Congratulations. And what we're going to do is, um, to all our winners, congratulations. We will be contacting you after this within 24 hours, within a day, to get your details. So be sure to check your Facebook Messenger or you're going to miss out on those quiz prizes. Thank you so much for taking part. And we've come to the end of the show. Thank you so much, Doc. I am definitely much wiser. I've learned a lot and I understand better what the teeth, and there's still work to do. I have to take care of it. Most importantly, um, taking care of your teeth is just not about brushing. You also need to floss and brush your
Tongue.
tongue. And of course, go and see your friendly dentist every 6 months or once a year minimum. Correct, Doc?
Yes, correct.
All right. So thank you so much. What was the biggest learning for you? Let us know in the comment. That was my biggest learning. And if you think this episode is useful and it can help make a difference to somebody out there to learn about their teeth, please be sure to share it. That's all the time we have for today. Thank you so much for tuning in, and go and make a difference out there by sharing the video. Yeah. Doc, thank you so much. We had so much fun understanding and learning.
All right. Thank you so much for having me.
All right. Thanks, guys. Bye.
Okay, bye.